Late. We go. Hello, Facebook. How you doing? Ronnie Kenyatta here, coming at you straight out of Alpharetta, Georgia this evening. I'm here with a special guest, Dr. Robert Galarowicz. Now, we're going to discuss, obviously, holistic kidney options and issues and topics. We're also going to talk general health. So this is going to be a lot of fun for me. One to the point, it's going to last half an hour. So I'll give you a quick a review of my last kidney information. I went to my kidney nephrologist or Emory Transplant Center last Thursday. Creatine's about the same, 1.41 I think it was. So I'm feeling great. Started working out, training literally one person, right now 3 times a week, trying to ease back into everything. So that's where I am. Now, let's talk about Dr. Galarowicz. I met Dr. Galarowicz after I retired from baseball. I think it was 2015. Like I said, just like with Dr. Henderson, I met all the natural kidney doctors late in the process, and by the time I met Dr. Galarowicz, my kidney, they were past the stage of really turning everything around. But the treatment he recommended for me, the supplements and everything he recommended, definitely made a difference in how I felt. So my goal is to spread the word in regards to that. Now, Dr. Galarowicz is a...
Yeah, Dr. Robert, it's much easier. Or Dr. G.
Okay.
A lot of people call me Dr. G, and that
Dr.
works.
Robert is a... That's even better. I like that. The people out there would like that as well, I'm sure. So Dr. G is a naturopath clinical nutritionist. All right. So Dr. G, floor is yours. I appreciate your time. The floor is yours.
Thank you. Thank you. I'm glad to be here. Dr. Robert Galarowicz. I practice out of New Jersey. I have 2 offices, and I also do like Skype phone appointments. I see people for a variety of conditions, from chronic illnesses to weight loss, and a lot of kidney disease. And that's one of my specialties, one of my big specialties, really my passion. But we're going to talk about a variety of topics. Do we have anybody on the line with us that wants to shoot any questions over? Or?
I'm still checking. I haven't seen anyone chime in yet,
That's
but
okay.
this will be recorded. So,
Well, if we
we'll
get
definitely
anything
be able
over,
to. What's that?
if we get anything over, they can throw any questions out,
All
and we'll
right.
just go from here.
Sounds good.
All right. So you were saying your vitamin D was low. So tell us, tell me a little bit about that testing you did, and just how you found out about it just recently.
Yeah, this was not the last testing, but the testing before. No, it was the last testing. I can't remember the number off the top of my head, but I just know I was deficient in vitamin D. And I think you asked me about that during our first consultation. And at the time, everything was fine. But yeah, I was definitely deficient in vitamin D. And I wanted to know what supplements that you recommended for that.
Sure. Let's talk about vitamin D for a moment. It's considered a vitamin, one of the fat-soluble vitamins, which means when you get it through your diet or in supplement form, it's best to take with a meal because a little bit of fat helps the absorption. Vitamin D deficiency is very prevalent in the U.S. And what we do is we take, this kind of this reference that you take a line from Atlanta, where you're from, right?
Yes. I'm sorry about that. Go ahead.
No, that's okay. So from Atlanta, where you're from, you start from there and you just draw a line directly across the country, and everybody in the upper portion has a much higher rate of deficiency of vitamin D. Because we don't get the sun all year, a lot of us aren't working outside. It's also called the sunshine vitamin, because you synthesize it from your skin from sunlight. You do get some from food, but the amounts we need, we find that they're large amounts that we need on a daily basis, and difficult to get it from food because, like I mentioned, you really get a lot of it from sun. And anybody above that line across the country from Atlanta, There's around, they estimate between 50 to upwards of 75% people are deficient. So I'm glad you got it tested. And do you remember what your number was?
No, I don't. I don't.
Okay, that's okay. But you knew it was below where you should be because the doctors told you that, the
Yeah.
MDs.
Well, yeah. It said that the blood work, the lab work said I was deficient.
Okay. And so when you are, a safe recommendation is 2,000 IUs a day. And
Um,
so there's two different types of vitamin D. There's actually three, but we're only going to reference two. So there's D2 and D3. Easy way to think of it is D2, okay, is the prescription, and D3 is the over the counter.
okay.
Now, if the medical doctor gives you a prescription, they got to give you 50,000 IUs once a week generally. And the reason that dose is so high is because it's synthetic, it doesn't absorb as well.
Okay.
And the one you can get over the counter is vitamin D3, which is the natural form, the one that you can say you get from sunlight, you get from your food. And you can get that in 2,000 IUs in one pill. They have pills, they have droppers. Some high dose multivitamins will have that for around 1,000. But to correct a deficiency, we say 2,000, and you can go upwards as high as 5,000. I think in a case like yours, post transplant, 3 months out, 2,000, I would look on the lower end, gradually raise it. If there's sun, you can get outside, get 15 minutes of sun, but not long. Thing with transplants, you're at a higher risk for cancer, so you don't want to be out there sunbathing. But if you got out there and got a good walk for 15 minutes in the sun, it'd be ideal. Plus, you get a little exercise. So that's D2, D3. D3 is preferred because it has more health benefits than D2. Okay,
Okay.
so even though both of them can get you out of deficiency range, do good things for your health, good things for your body, especially with kidney disease, you want to have an adequate vitamin D3. It has a big impact, but your overall health. Um, so you want to make sure, D2 is okay, D3 is better, and it is over the counter. Same price wise, even with a copay for D2. So,
Hmm.
some D3s can be a little more expensive on quality, but get your D3. And if you're deficient, 2,000 IUs, you can go as high as 5,000, and you should get retested 3 to 6 months after taking it.
Okay.
Oh, so you
All
ready to
right.
pick up your D3?
What's that?
You ready to pick up your D3?
Oh, definitely. Yeah.
Can you
Yeah.
hear me okay?
Yeah. I was making sure the volume on the actual Facebook Live presentation was working, but we're all set.
Okay. All
Yeah,
right.
definitely. Oh, go ahead.
Oh, no, I was going to say, so that's vitamin D, in a nutshell, a lot more to it, but that's the quick basics of it. And everybody should get tested. That's something that a lot of people just don't do because their doctors don't run it. And a lot of people assume their medical doctors are running everything and doing everything. Because I see a lot of people here, and I'm like, they don't have the blood work, but I might ask them about it. And they say it's fine, doctor says it's fine, but then I ask them to go check their vitamin D and maybe other things, and a lot of times they come out deficient. So everybody should be having a yearly physical with your medical doctor. Or if you're in a state where a naturopath can do blood work, you can see a naturopath. It is state regulated, so it does vary. I'm in New Jersey, an unlicensed state, so I practice as a complementary therapist in conjunction with medical doctors. So see a medical doctor or someone that can do blood work, yearly physical, and always ask for your vitamin D to be in there.
Sounds good. Sounds good. Yeah, I was like I said, I know we discussed that initially. That's the first, like I said, that's the first thing you mentioned was check your vitamin D. And I've always been tried to stay cognizant of my vitamin D levels. It was never an issue until now. Even during dialysis, it was never an issue. This is the first
Cool.
time it's I was aware of, and I definitely wanted to address it. So I appreciate the info.
Are you taking a multivitamin?
Yeah, the one you recommended with the CoQ10 time release. I don't have one.
Yep, I know it's by Pure
Yeah,
encapsulation.
exactly. Yeah.
Okay. Good. In general, everybody should be taking a multivitamin. All right. Doesn't matter if you have a kidney problem or you don't. Even if you feel fine, everyone should take some form of a multivitamin, preferably a little better quality one than the one a days that you might pick up at like a pharmacy. I mean, even though those will give you something, some nutrients, but you do want to get a better quality one. Reason is because like a large percentage of people are vitamin D deficient. A lot of
Mhm.
people are deficient in other nutrients. So it's common if you're deficient in one thing, you're probably going to be deficient or insufficient, meaning not having enough optimum levels in other things, other
Mhm.
nutrients. So you should take a multivitamin with women who are menstruating. So women who are having their menstrual cycle, having their periods, they should take a multivitamin with iron. And that's generally the difference that you see. When you go to a store and you see a multivitamin with iron or a men's multi and a women's multi, the big difference is generally the iron. All right, that's always going to be iron in the women's, and generally they don't put iron. They shouldn't put iron in the men's multivitamins. Okay? And any a woman, any female within menstruating that is menstruating should be taking an iron every day because it's very easy to become anemic and not have enough iron levels. So they feel fatigued a lot. They're always tired. So I see a lot of women with that and address that quite often. You know, anemia, iron-related anemia due to menstrual cycles.
I'm glad you mentioned that because I have friends and some clients, female, that deal with iron deficiency. So, ladies, I hope you're paying attention to what Dr. G just says. Valuable information. Now, I got a question. I have a question in regards to multivitamins.
Hmm.
Now, you'll you'll take a multivitamin and it can change the color of your urine. Is that a situation where you're just totally eliminating the nutrients, or is that
Well, if that
something that's
happens,
normal?
you should panic and go run to the emergency room right away. I'm kidding.
What's the
No,
plan B?
it's actually completely harmless. So
Okay.
you have fat soluble and then water soluble vitamins. So I mentioned before about the fat soluble. Fat soluble will store in your body for a longer period of time. So there, your body can absorb it and hold on to it. And then the water soluble, which is all the B vitamins and vitamin C, your body just takes what it needs for that period of time, okay, and then it excretes the rest through your urine. And so when you see that real yellowy, some people say fluorescent yellow urine that you have after taking vitamins, that's just the excess being excreted out. You will maintain the level of some B vitamins you've been taking for a while, but overall they're water soluble, so they don't store for long periods.
Okay.
And so that's what that yellowy urine is. When I first started in practice, I didn't tell people this, and so I had a lot of people coming back in the beginning for the first little bit of time and with this, is this okay? Is this a problem? People calling me. I see this. No, it's perfectly safe. You don't have to worry about it. It's extra B vitamins and vitamin C coming out. Your body took what it needed from those and got rid of the rest.
Okay. Sounds good. Sounds good. Um,
And speaking of iron for women, since a lot of women have problems with this, and then their doctor just says go take an iron pill. Okay, so they get one. And just about all varieties of iron, or most of them over the counter, will cause constipation. So it's a problem that a lot of women they don't like to take them because they cause constipation. So if you need to take iron, you're going to take extra iron. I want to tell all the women out there, and this goes for men too. Sometimes men will need iron. In kidney disease, sometimes you might need iron. Okay. If men haven't, they don't eat a lot of nutrients or a lot of foods with iron, they might need one after a period of time. You shouldn't take a multivitamin, or men should not take iron regularly, only if your doctor tells you so. Um, so the one that I recommend is an iron bisglycinate. Okay. Also referred to as gentle iron. I'm gonna
mhm.
grab it off one of them off my shelf here. If we can see it. This is just one brand of many. Um, Iron bisglycinate. Get it up there a little better.
Uh,
Yep, I use this one in my practice, but like I said, there's a lot out there, a lot of good companies, and it's about twice the absorption of regular iron, which makes it better, so it can bring the levels up quicker.
mm,
And it also the nickname is Gentle Iron. I think Solgar has a patent on the name Gentle Iron. So if you search Gentle Iron, I think Solgar comes up, but that one's fine too. I've had a lot of women use that one. But iron bisglycinate, non-constipating, twice the absorption. Uh, and less trouble, less fuss. So
Okay.
important for women especially. It's a big, big, big problem, and I see a lot of women with this, and just a matter of getting the right iron, the right dose, along with the other cofactors. So a multivitamin would be good. You take your iron.
All right. Um, Another question, the big topic that I'm dealing with now, sleep or lack thereof. And what can you recommend from a holistic perspective for someone that's having trouble sleeping?
Well, sleep can be a variety of things, so you need to look at it. Whether you're stressed out, you can't calm your mind down. So there's people who, a certain type of person, I've gone through this myself, where your mind is just, you're thinking a lot when you're trying to go to sleep. So, like your mind won't shut off. A lot of people say, I can't shut my mind off. Right? And in a case like that, you can always do things like stress reduction, yoga, meditation. For some people, just going on YouTube, searching a tract like a guided meditation, guided imagery for sleep will help. If we're looking to take something, we'll talk about melatonin, all right? Because that's a natural hormone that your body produces to regulate your sleep-wake cycle, and it's over the counter, and it tends to help people who can't shut their mind off. So that's the type of person it tends to help. One of the side effects is vivid dreams. All right, a lot of people they talk about the dreams are too vivid, they feel too real. Now, these side effects are in smaller, much smaller percentages, populations of people, but I just want people to be aware of it, where what you're getting into, because everything can have an effect in your body. Anything you put inside your body can have an effect. Okay, so it doesn't matter what it is. Um, it could be a supplement. Generally, they're safer, they're better, but like I said, anything you put in your body can have an effect.
Yeah.
Whether it's from a food, a supplement, a pharmaceutical, whatever it may be. Um, so going back to what we're talking about with the melatonin. So melatonin is a natural hormone. You can purchase it over the counter. Shown to be very safe. Side effects are vivid dreams, and we're talking only short-term use right now to help you get back into a proper sleep cycle. You'd want to take it maybe about a half hour for bed. And when you do, you want to start with 3 milligrams. So the milligrams do vary. We like to start with 3 because it's a dose that is shown to avoid something called nicknamed melatonin hangover. So people sometimes will take melatonin and be like, yeah, I got to sleep, I stayed asleep, but I couldn't wake up in the morning, or, I woke up, but I was groggy for the whole day or in the morning hours, half the day, whatever. If that happens, you need a lower dose of melatonin. All right, so maybe if 3 is too much, maybe you need 2. They do sell them in 1 milligrams. I tell people they can take their 3 milligram pill and just break it in half, or open the capsule, empty out some powder, and you can take the powder later, save it somewhere in some Tupperware. And start with 3. You can go as high as 9, even 12. We recommend generally 3 to 9. Older people need more because their bodies don't produce the melatonin that they used to when they were younger. So 3 to 9, this works in a lot of people with overactive minds. You can try it regardless. It's not 100% everybody, but it's a good natural option that I've found to help a large percentage of people with sleeping.
Okay.
And that's one option. You have to look at stress reduction. Another one, if stress is affecting you. Low magnesium status and taking extra magnesium will also help.
Okay. Okay. I want to
Um,
give.
Also look at medications. People, make sure any of the medications that you may be taking is
Yeah.
interfering with sleep. Um, a good sleep schedule is important. Trying to go to bed around the same time every day and get up at the same time. But if you do have time to sleep in, meaning you can stay in bed a little longer and you feel more well rested, you shouldn't force yourself to get up at like earlier, like if you have a set schedule during the week.
Yeah. I feel good about my situation. I think I'm doing everything, so I think it's a matter of time for me personally. But
I do. Unfortunately, with your situation with the post-transplant, this is one of the side effects.
yeah.
Um, it should clear up. I'm pretty confident that it should be better. It is something. I've had issues too with sleep
Yeah.
post-transplant. I had it for a while after, even years after, but I didn't, as I got more trained and learned how to better manage my sleep. One of my patterns was problems was being in a proper sleep pattern. Sometimes I go to sleep really late, get up early, then sleep in, if I could. And once I got that, it really helped me a lot.
Hmm.
Now I get good sleep just about every night unless something happens.
I look forward to that myself.
But
um,
I think they gave you some options over at
yeah,
the center, so they're safe to use right now. So, and getting
that's
sleep, it's more important to get sleep than not get. Like sometimes people are against the med, and in a situation, I'm not against it. It's more important to get that sleep, even if it's kind of, some people say, well, it's artificial, but I'd rather you sleep than not sleep because your immune system is much, much more active when you sleep.
yeah.
And that's where you recover, where you heal, where you repair. So I'd rather you sleep than not sleep.
Yeah, I mean, I was hard headed initially myself. I'm stay away from the meds, but it's to the point where, like you said, yeah, I just want to sleep. So I'm open to whatever at this point.
Yeah, yeah, and that's way more important because I've seen people try to fight it and it's not. It's just you need sleep,
Yeah.
whatever you have to get it.
All right, we're at the right about the 20-minute mark. Do you want
Okay.
to dive into the kidney info a little bit for the people?
So about kidney disease, everybody should be get screened for kidney disease, and they do it on your regular lab work. One of the issues that I have with getting screened is for kidney disease. Your doctors don't tell you always when you're starting to lose function. Doesn't mean that they don't all tell you. That's not true at all. But there's a lot that just kind of have an attitude, especially if you're an older person. I find this to be very common that as people age, their kidneys can lose function, and doctors tend to ignore a lot of this. So I end up getting a lot of calls, a lot of emails from people who are in the later stages of kidney disease, and a lot of times because their doctor just didn't tell them. So something that you want to look for, you should always just get your blood work and just get used to reviewing it. Now with the internet, I mean, you can learn the basics of just enough Googling and looking what each thing is and means. But when you get your blood work, something called the creatinine, all right, is one of the basic measures we have on there for kidney function. And most labs, it's around 1.2 to 1.4, and under that is normal. Okay. Another thing to look at is the GFR, which they did transfer over to this number about, I don't know, maybe about 8 years or so ago. And this is the preferred measurement. It's still argued among a lot of medical doctors that if the creatinine's better or is the GFR better. I think, both of them, we got to use everything we can. So the more information, the better. So the GFR, you should always be checking. So the GFR is normal if it's 60 and above on labs. And that's a big range because it can be upwards of 100. And I've seen some GFRs of 110 and
Wow.
15.
Hmm.
So you can always ask for your copy of your blood work and just check the GFR for yourself. So if you start seeing around 65, 70s, with a good healthy function, I mean, there's no reason you shouldn't be in the 90s. For a majority of people who are healthier in that 80, 90s range. If you start seeing the lower end, it's time to question a few things. Maybe you're not drinking enough water, something important for the kidneys. You got to drink enough. Okay. Any dehydration is not good for kidney cells at all. Especially dehydration with low blood pressure. When you sleep, blood pressure goes lower, and then with dehydration, you can kill kidney cells. So something to look for. Just get a copy. Look at the creatinine, all right, and the GFR. And do you know what yours
I don't know off the top of my head. No, I can.
is,
Thank you.
Ronnie? Oh,
Yeah,
we
I'm here.
paused
I'm back.
here.
I'm back. Can you hear me? Thank you. But yeah, we lost you.
Yeah, I can hear you. I can't really see you, but I can. Oh, there you go. Hear you a little better.
Yeah. Okay. All right.
Okay.
Um, I don't know what it is. As you talk, I can pull. No, they didn't post it for this week yet, but I can. As you're talking, I can look it up.
Yeah, go look it up and let's
All
see
right.
what's at.
Okay.
And to let everybody know, my GFR, it's about 43. So I had my transplant 11 years ago. I got my transplant in stage 3. So unfortunately, transplants might not always work 100%. I got mine at stage 3. It's still at stage 3. I'm still stable. I actually gained a little function back. So mine's at 43. So if you look at that up, it's a stage 3 kidney disease, and I can hold. My belief is I'm going to hold at that forever with the right lifestyle, nutrients, and not my belief, but the research showing. So did you find yours yet?
I'm still looking.
Okay, yeah, take a look. Let me know when you find it. So everybody should take a look at your GFR. Water, important guys. You got to drink your water. There's no substitute for water. We can say herbal teas are a supplement. I mean, herbal teas can be a replacement for water, but you really got to get the water in, or herbal teas. Ideally, what they recommend is half your body weight in ounces of water per day. Okay, it's depending on the size you are, it could be a lot. But if you get eight ounce glasses per day, 64 ounces, you're going to be doing a lot for yourself. So that's a good amount of water for people. Ideally, half your body weight in ounces. You don't need to overhydrate. You don't need to go past that point unless maybe you're an athlete, you're sweating a lot, you're working out a lot. If you work maybe in a hot kitchen, some restaurants, you're going to be sweating constantly, so you could probably drink more. But for the most part, that's a good recommendation. And good old water, H2O.
Found it.
I found it. Okay, what's your GFR?
69. Lost it.
You lost it?
No,
Oh,
I said it was 69.
okay, 69. Good.
Good.
Um, is that for the African American part?
Yeah,
Okay, and what's the non-African American?
60.
Okay. Okay, good. So let me explain that actually. So on the GFR, you're always going to see the two readings. It's going to say non-African American and African American. And the reason is African Americans don't get the perfusion in their kidneys, okay, as other races do. So we have a separate GFR set up. So yours is 69. That's good. So you're above
Okay.
60. We know you're transplanted with a creatinine 1.4. This is all, still really good. With the transplant, we expect a little decrease in GFR. That may come up. It's only been 3 months. So some people, especially in the transplant centers that I've been at, have come up. Then after a year, they still got more function back. But you're still healing.
hmm
Still not all
Yeah.
there
Oh,
yet.
yeah. Yeah. That's that's something that, like, when I'm moving around a lot more, I feel it. Just daily activity, definitely feel that the body's still adjusting.
Yeah, yeah.
So,
But you're still
me, I'm
great.
anxious. What's that?
69 is great.
Oh, perfect. Awesome.
I'm
Awesome.
happy with that.
Nice. I pulled everything up, so the phosphorus has dropped a little bit. Magnesium is still low, but it's
It's
getting
still
close. I'm
low.
at 1.7. It's
One
I
sec.
started taking the magnesium. It's at 1.7. It's going up.
All right, that's on the serum too. Not the red blood cell. Okay, so you're gonna have to take more magnesium. That's probably why you're
Okay.
probably having trouble sleeping.
Okay.
What are you taking now? Which magnesium?
The one you recommended.
Uh,
Can't think of the
the
name of it right now.
orotate, right?
Was that? I can't think of the name of it, but I'm definitely taking the
I
one
think it's
you.
magnesium orotate, 500 milligrams.
Okay. Yeah. Yep. Yep.
How many a day are you taking?
I'm just taking one, 500.
You gotta take two.
Okay.
Yeah, you
Start that
definitely gotta
tonight.
take two.
Start that
Uh,
tonight.
yeah, take two. Make sure they keep checking on your labs. You might have to take more.
Okay.
Um, So magnesium is sometimes an issue with transplants, not always. Sometimes it is. Um, I forgot the exact clinical term, magnesium wasting syndrome, I think in transplants it's called, or magnesium sparing, magnesium wasting. So you waste a lot of magnesium, you lose it. So you're
hmm
gonna, especially now that we have the blood work showing that you're deficient, you definitely got to take more magnesium to get your levels up. One of the problems is when people get their magnesium from the medical doctor, or even when they go to the store, they get magnesium oxide, which isn't very absorbable. That's more for the intestines. It helps with constipation. So we want to get other forms. Magnesium citrate is a better form, but it still affects the bowels a lot. So you might find yourself with loose bowel movements, diarrhea. So we like other forms like magnesium glycinate, magnesium orotate, magnesium chelate, magnesium malate. Okay, so there's a lot of these different forms. And, you're taking orotate. I take orotate for now. I've switched around. It's a lot of it's about the dosages. So, you're going to double yours,
Okay.
right, to 1,000 milligrams a day, and you'll be getting the labs, and we can see what the numbers are at.
Sounds good. Sounds good. Looking forward to it.
Yeah, and that's probably partially why you're not sleeping.
Yeah, well, I'm definitely gonna change that tonight.
Yeah.
Definitely change it. Changing that tonight. That's good. Maybe between the doses, the increase with the what the doctors recommended, along with this increase in magnesium, hopefully I can see some results.
I think so. I think a couple take 1,000 tomorrow. Just keep taking 1,000 to your blood work.
Okay.
I have such bad magnesium wasting that I have to take 2,000 milligrams a day. I've been taking the orotate just because the milligrams is higher. So
Yeah.
I developed that years later after the transplant. It's a side
Mhm.
effect of some of the meds I was on. I was a little bit higher doses of the anti-rejections. They lowered them a couple of years ago, and it's worked out a lot better for me.
Mhm.
But I have to take 2,000, and I'm doing some more extensive blood work, checking some of the stored counts, and I might have to take more. Hopefully not, but I take 2,000 a day, 1,000 in the morning, 1,000 at night,
Oh,
and it
okay.
just
So
keeps my blood work sufficient.
yeah. Hmm. Like I said, after that, more results and hopefully getting some. No, not hopefully, getting some sleep.
Yes, need that sleep.
Yeah, definitely, definitely. See, I noticed something. Everybody here, the holistic doctors, Dr. Henderson, she became a naturopath. You know, talking to you, you had a transplant, you became a naturopath. I'm the only one now that's not a naturopath here, so I guess I need to change my profession.
Maybe so.
I just found out my other calling. I wasn't listening.
Yeah, why not? Why not? We need more good people in the field.
Yeah, exactly, exactly. Um, well, it's a little past. Let me make sure. Yeah, it's a little past 8:30. You want to keep going, or
I think we're gonna wrap it up. I'm actually getting a little hungry, but if you want to, do it another time again, that
definitely,
works for me. Um,
definitely.
actually, can you send me a copy of this, the video?
Yeah, yeah, I will.
Yeah, definitely send me a copy, and then we can schedule another time, do it again. I'm getting a little hungry. I'm at the end of my work
Mm.
day here, so
Yeah, I have a
get a little
long
food.
drive ahead of me myself. I do have one thing I want to mention. Your product, the ebook.
Yes. Yeah, can't leave without saying that, right? So, in terms of what I offer, so I do phone Skype consults. You can visit my website, I have a few different websites, and I also have some products for some kidney disease. I have a bunch of books out. I have one on diabetic kidney disease, one on it's called the All Natural Kidney Health and Kidney Function Restoration Program. At the website is healkidneydisease.com. And the good thing about the program is it comes with email consulting with me. So bless you.
Definitely.
That's really the big benefit. You get to consult with me through email. And so even though I need to update the materials, they're still good, but I do need to update them with the research that's come out. But you can contact me. I'll get back to you personally. One of my staff will just forward the emails after purchase. If you have questions before that, you always can. But what I'm able to do is able to actually personalize and put together a real plan for you. So regardless of what kidney disease issue you're dealing with, from an autoimmune to diabetes, I can personalize the program for you. And so it's really a great value. It's email consulting with me. Plus, you get any of my books, the ones that apply to you. I'll tell you which ones to use, and you get them, as part of the consult too. So that's really good. You can visit my website, healkidneydisease.com. Another website is drrobertg.com about my consulting services. Has to do with my private practice. I've got a new blog coming out. Actually, I didn't tell anybody about this. You're the first one to find out. And this
Okay.
is going to be long term. There's no, posting constantly. I've got a team on this. It's healthykidneyinc.com. healthykidneyinc.com, and I have some supplements coming out shortly. But more
Yes.
importantly, whether you don't buy anything from me, and I don't really care if you do, because I just want you to be healthier in your kidneys. I don't want you to go through the things like dialysis and things that you had to go through.
Yes.
Healthy Kidney Inc. is just free information, and I'm covering studies. There's going to be videos, articles, so you should definitely sign up, follow. Um, I'm probably going to be up and running about a week and a half, 2 weeks with it. But this is going to be something that's been in the planning for years to keep people up to date of all the new research information, free tips, anything that will benefit people with kidney disease. So healthykidneyinc.com, Healthy Kidney Inc.
If you don't mind, Dr. Galarowicz, would you email me this information so I can post it on the this when we show this broadcast? I'll
Yeah,
post the
absolutely. I'll send it
information.
over to you, and we can post it. And if you get any people who watch the video, we get questions that come in. Like we can always set up another segment to answer them.
That's perfect. That's perfect. This is exciting for me. I'll let you go after this. This is exciting for me because I'm starting to really build a information source for natural kidney dealing with natural kidneys.
Good,
Prevention.
excellent.
I have all your interviews going on YouTube. Dr. Henderson is. I'm interviewing my surgeon next week. So this is gonna be a good amount of free information people can use on my part. And of course, you have your new website. So this is
Yeah, Healthy
exciting.
Kidney
I'm glad
Inc.
we're excited. Yeah, I'm glad this is taking place. But you're hungry, and I got a long drive. So we call it a night. Definitely appreciate your time, Dr. G. Anything else you want to say? Can we close it out?
No, stay healthy, stay happy, everyone. And this is a good video to watch. I'm glad anybody who watches is gonna get a lot of information. Good stuff.
Sounds
Thanks for having me. I
perfect.
really appreciate it.
Thank you. Thank you. No, not enough thanks coming from me.
All right.
Folks out there, when you watch this video, make sure you like it, please, and make sure you share it, get the word out, and we'll have all Dr. G's information in the description. So that's all we have, folks. Once again, we'll take Dr. G for his time, and everybody have a good evening, and I will be in touch with you guys. Bye-bye.
Thanks
Thanks
a lot,
again,
Ronnie.
Dr.
Bye,
G.
everybody.
Bye-bye.